Good morning, Dr. Kim. Nice to meet you.
Nice to meet you.
Can you please introduce yourself to our viewers?
I'm Dr. Kim Sam, Director of Soonplus Plastic Surgery.
Okay, so doctor, today we'll be talking about noble surgery, right? So what exactly is noble surgery?
It's difficult to find the origin of the name Noble Surgery, which is also known as Paranasal Augmentation. But judging from my 20 years of surgical experience, it may be because Korean society rarely sees the appearance of a mouth sticking out as luxurious. Paranasal augmentation is a procedure for those whose mouths are visible because of the sunken center. This procedure has many effects, but the most prominent is making the patient's mouth look less protruding, therefore giving them a classier look. That, I think, is why people have coined the term noble surgery.
Okay, so usually who are the patients that need this surgery?
As I said before, most of the people who get this surgery are those whose face have a sunken center. This is seen when taking a photo from the side, as it shows that the center part is flat and there's no so-called three-dimensional effect. People with this kind of problem are the target for paranasal augmentation.
So after the surgery, what kind of results are expected?
The effects can be broadly divided into two categories. The three-dimensional effect now exists on the patient whose facial center was formerly flat, and the effect of improving laugh lines.
So now that we talked about the results, let's talk about the methods used during the surgery.
For the process of paranasal augmentation, I'll have to explain once again that it's about lifting the sunken midface for patients. So in order to do that, we insert a prosthesis into the midface. The process depends on which prosthesis is going to be used. The most fundamental way to do it is to use one's own bones. But it is not easy at all to get bones from somewhere else for paranasal augmentation. So generally, the other materials that we use are silicone and Gore-Tex. These two materials have their own advantages and disadvantages. Silicone has the advantage of being easy to remove, as it is a prosthesis that exists completely separate from the body. But when it comes to paranasal augmentation, it is inserted at an area where there's a lot of movement. So here comes the drawback of silicone. The prosthesis has a possibility to move over time. I personally mostly use Gore-Tex, as the term adhesion isn't necessarily negative here, but either way, I prefer the use of Gore-Tex.
So, okay, you explained about the methods, but can you tell us a little bit where the incision is made in this kind of surgery?
There are two methods for paranasal augmentation. One method relies on targeting the patient's nose or inside of the nostril, while the other method involves targeting the mouth. As you can see right here in my hand is a model of a human face. If our approach involves the skin of the nose, the prosthesis is placed directly on the bone. So we have to cut out all the skin and muscles in order to place the prosthesis. On the other hand, if we approach this procedure via the mouth, right here on your gums, if you put your tongue on it, that part is bone. So if one does an incision on the gums, the bone can be directly accessed, rather than accessing the target through the skin, because there's little tissue damage and no scarring. I personally prefer to work through the mouth.
Okay, perfect. So after the surgery, when the patient is done and going home, what should he do or she should do at home to manage this surgery?
There's nothing in particular to be careful about. You could eat right after the procedure. If your concern is the scar in your mouth, you just need to keep the insides of your mouth clean. You don't necessarily need any disinfectant or treatment. That's because the mucous membrane in the mouth recovers really fast. The scar would heal within a quick 2 to 3 days, and for the stitches, we use stitches that dissolve over time, so there's no need to have them removed, as dissolvable stitches would disappear naturally.
Okay, so side effects. Is there any side effects to this surgery?
So, side effects are unavoidable with any form of surgery, but in the case of surgeries with prosthesis, the main thing we need to be cautious of is the infection. There are various surgeries that involve using prosthesis. In the field of plastic surgery, in my experience, like paranasal augmentation, but I think it's one of the least inflammatory surgeries. If you're wondering of how quick, in my opinion, the surgery itself is a quick process, but of course, that's in my opinion. And as I said before, the recovery rate is faster when doing the mouth incision. The air exposure time is short because the wound heals quickly, and the tissue itself is a good place for blood circulation. There's almost no inflammation when compared to other surgeries and with other implants. Aside from that, bleeding isn't a big problem in this surgery. You don't need to worry about these side effects.
Okay, perfect. Now we'll talk about the breast